Jayapal, you're recognized for 5 minutes.
Thank you, Madam Chair. Secretary Becerra, it's good to see you. Congratulations on the important work that President Biden and your department have done to lower prescription drug prices, to improve transparency for patients, and to bring the number of Americans without health insurance down to historic lows. This is very, very important work. And of course, you know that despite these historic lows, there are still 25 million people who are uninsured in America. And on top of that, many Americans are still underinsured, meaning that even if you have insurance of some kind, you simply can't afford health care. The premium tax credits that we included in the Inflation Reduction Act serve as a very important patch for our broken for-profit healthcare system to immediately lower costs for Americans. But as you know, my belief is that we're only going to have full accessibility when we transition to a single-payer Medicare for all, improved Medicare for all model. Medical providers are steering patients towards bank loans and credit cards that saddle them with interest on top of their medical debt. It's really unimaginable that in the richest country in the world, 23 million Americans owe $220 billion in medical debt, the majority of whom owe over $10,000 in debt, which just continues to accumulate interest. And meanwhile, we have private insurance companies that are doing everything they can to continue to raise premiums and lower care, and part of that is an increasingly public effort to privatize Medicare. As you know, I'm the proud lead sponsor of Improved Medicare for All because I believe it's time to make sure that our healthcare system prioritizes people over profits. A recent Congressional Budget Office study estimates that transitioning to a Medicare for All system would actually save $650 billion per year in costs. And so I'm going to continue to work on that. But in the meantime, I want to discuss what can be done right now to improve healthcare for all Americans and prevent wasteful subsidies to corporate insurers that offer what I call Medicare disadvantage plans. It's estimated that the federal government will overpay Medicare disadvantage companies approximately $83 billion in 2024 alone. $83 billion. That's at least 4 times as much money as we would need to expand traditional Medicare to cover dental, hearing, and vision benefits. A report from the Committee for a Responsible Budget showed that over the next decade, these overpayments will increase the national debt by at least 2% of GDP and advance Medicare Trust Fund insolvency by 3 years. And so I want to thank you particularly for your very strong 2025 Medicare disadvantage rate notice that your department put out in April as it takes key steps to curb these drastic overpayments. How can Congress continue to partner with your department to go further in curbing overpayments?
Congresswoman, thanks for all the work you've done on this, and I'd say that probably the most important thing you can do to help us with is transparency. We need to get behind the curtain of these insurance companies to find out how they're operating because, as you mentioned, they're getting paid more than the traditional fee-for-service Medicare. We want to see how they're spending the money because in some cases they're saying they don't have enough and they're going to have to start cutting services. And it's not Medicare that would be cutting, it would be the insurance companies.
Not only are the plans exorbitantly costly, but without that kind of meaningful oversight that you're talking about with bad actors, these plans actually have negative health impacts on Americans. An analysis from the National Bureau of Economic Research found that if CMS canceled contracts with the worst performing 5% of MA plans, it would save 10,000 plus lives per year. Can you tell me what resources your department needs to strengthen enforcement mechanisms and how strong oversight of these plans can actually promote health equity and health care for people across the country?
I probably need 5 minutes to give you the full answer because, as you know, the Centers for Medicare and Medicaid Services has been underfunded for more than a decade when it comes to its budget, even though it has been asked to do the lion's share of work at HHS when it comes to Medicare and Medicaid. If we had an agency that was fully resourced, we could certainly be more aggressive in trying to do the work to get behind that curtain that I mentioned so we could see exactly how taxpayer dollars are being spent by all these recipients of these dollars, the insurance companies and so forth.
I really appreciate your work on this, and I have to tell you that and I've said this to you separately outside of the hearing, I'm hearing from constituents every day who are getting pulled into these Medicare Disadvantage plans, promised a whole bunch of stuff that they don't get, and ultimately then end up trying to get off of them, which is extremely difficult in many cases, and get back on traditional Medicare. I think we need to continue to improve traditional Medicare and make sure that we provide health care for all Americans. Thank you for your work.
Thank you. Mr. Banks, you're recognized for 5 minutes.
Mr. Secretary, the number of children who have